Turning to the U.S., the country has now hit 350,000 deaths. It's a number Dr. Anthony Fauci says he never expected the U.S. to reach. He says having 2,000 to 3,000 deaths a day is terrible. The U.S. has also topped 20.4 million cases of the virus. On ABC's This Week, Fauci says there's no running away from the numbers. As he dismissed today's tweet from U.S. President Trump, that tweet claiming without evidence that the number of U.S. cases and deaths from COVID-19 in the U.S. is exaggerated and is, quote, fake news.
Well, the deaths are real deaths. I mean, all you need to do is to go out into the trenches, go to the hospitals, see what the healthcare workers are dealing with. They are under very stressed situations. In many areas of the country, the hospital beds are stretched. People are running out of beds, running out of trained personnel who are exhausted right now. That's real. That's not fake. That's real.
Fauci blames indoor activity and holiday travel for spreading the virus, and he's calling for increased compliance to public health measures. Trump today is reacting on Twitter, complaining that Fauci works for him, yet he isn't given credit for his work, saying that's more fake news. For more on this, I'm joined by Dr. Amesh Adalja. He is a senior scholar at the Johns Hopkins Center for Health Security. Doctor, thank you so much for joining us today.
Thank you.
I want to get your initial reaction to what we just read there about President Trump, what he has been saying, his tweets specifically about Dr. Fauci.
I think we have to stop wondering what Donald Trump is tweeting about Dr. Fauci. Donald Trump really has nothing on Dr. Fauci. Dr. Fauci is a premier infectious disease physician, a hero, somebody who's guided everything good that's happened in this response. And the fact is, we're lucky that Dr. Fauci works for the U.S. government and has been there for multiple presidencies, is not a political appointment, and President Trump has zero power to actually fire him. And I think that what you see is Donald Trump jealous of Dr. Fauci because he attacks him not for anything wrong that he did, but for his strength, for his power, for his intellect, things that Donald Trump has sorely lacked in his own response to this pandemic.
Right. Quite stunning, actually. I do have to ask you what you think of what Dr. Fauci was saying, though, that the fact that he never expected the death toll from COVID-19 in the United States to reach 350,000. What do you make of that number?
It's an astronomical number, and none of us really thought that the U.S. response would be so horrible that we would reach 350,000 deaths. We look at countries like Taiwan, where the deaths are in the single digits, and you have to wonder, why did this happen in the United States, which we were considered the most prepared country for any pandemic, yet this happened. And it really goes to the incompetence in this pandemic response from the federal government. And I think that's where the 350,000 that blame for the 350,000 deaths has to squarely fall on the federal government's default in managing this pandemic from the very beginning. And it's only going to get higher as we move into these winter months when we see these surges occurring based on holiday gatherings.
Right. And I did want to ask specifically about California, what we're seeing there. It's being viewed as the new epicenter of the COVID-19 pandemic in your country. Are you surprised by that, given that it appeared California was following public health guidelines?
You have to remember that right now we're seeing a shifting in the epidemiology. Many of the public venues, restaurants, those gyms, all of those have changed their operations. So people aren't necessarily getting infected there, and they've been closed in California for a long period of time. So what's happening are people are getting infected in private gatherings. They are letting their guard down, and we're starting to see transmission occur. And it's really become probably the majority of transmission in some parts of the country. California is one of the puzzles that this virus has posed to us, that what public health interventions work, which ones don't. And I think we really have to go back to public health infrastructure. Can you test, trace, and isolate? And California has not been able to do that. Even during the summer surges, they were hit pretty hard. And I think this really speaks to the fact that we're not prepared as a nation to deal with the fast-moving infectious disease outbreak, because we don't still, in December or January now of 2021, have the ability to test the way countries like Taiwan and South Korea could do almost a year ago. And I think that's really reflected in the fact that we've got so much community spread.
So you're pointing out issues with the testing regimen in the United States right now. What about the vaccination rollout? Because the Trump administration had said that they would have 20 million people vaccinated by the end of December. That has not happened yet. Do you think that is also contributing here?
I do think that the federal government, there's a risk that the federal government is going to do with the vaccine rollout what they did with testing and foul it up. We know that vaccines are rolling out at a very slow pace, much slower than we wanted to, and we know that this is the only way that we have in the United States to get out of this pandemic. So I think we need to accelerate vaccinations substantially. We need to make sure that the state and local health departments, the ones that are responsible for coordinating the vaccination response, have the resources, have the manpower, because we know that many of these places are tasked with responding to an inordinate number of cases and at the same time have to roll out a vaccine program. So we have to make sure that they are well resourced. And this is something we all predicted and knew was going to happen because there was going to be such a major issue trying to put out a vaccine to the entire country, basically, a Herculean public health effort. And we wanted to make sure that the planning was in place. And unfortunately, again, the federal government is failing us the way it failed us with testing.
Okay, well, let's hope that 2021 brings changes. Dr. Amesh Adalia is a senior scholar at the Johns Hopkins Center for Health Security. Thank you so much for joining us today and for sharing your insights with us.
Thank you.